Expected to start school this week will have spent their first few months living under strict rules during the COVID pandemic. Researchers from 6 universities around the UK are now studying the impact that lockdowns had on children when it comes to their talking and thinking skills and what support they may need during their education. Our education reporter Vanessa Clark reports.
It's the last few days of preschool for Mikhail and his friends. He was just 8 weeks old when London went into lockdown. His mum hasn't forgotten what his first year was like.
It was just very isolating and quite sad in the sense where he couldn't experience all the lovely things that my other son could experience, all the bonding experiences and all the developmental things like mummy and baby swim and play centres and play groups, even going to the park. That we couldn't do that. We were completely at home.
Mikhail has speech and language needs, along with a third of his classmates here at Elizabeth Selby Infant School, who will be starting reception this week.
Cross, down and round.
And the school agrees the pandemic has had a huge effect.
Lots of those families, as they haven't had health visitors and they haven't had lots of access to GP appointments, we're often the first port of call who's kind of talking to them about the needs of their children.
Is it harder to get referrals now from NHS services and from different places?
Yeah, we're finding that the threshold has gone up for local NHS services. So for speech and language therapy, we're often using our in-house therapist because we're finding that referrals to the NHS is just very hard to get through because the service is so oversubscribed.
We're going on a hunt, we're going to catch up.
For the first time, the school have employed a speech and language therapist for its preschool class. But changes like this cost money, meaning difficult decisions for the leadership team.
Next year, he'll probably need one-to-one support.
The school is dealing with more children with special educational needs, attendance issues and a huge increase in children needing help with toilet training, all issues that were accelerated during COVID. When the first lockdown arrived, baby classes were cancelled, many appointments were no longer face-to-face. Everything changed for the families of newborns living here. Researchers from 6 universities across the UK have come together to look at the impact of lockdowns on newborns in a project called Bicycle, Born in COVID Year Core Lockdown Effects. It will follow families over the next year, testing children with interactive games and comparing them with those born the year before and after. Vital research for the future.
The lockdown disruption was totally unprecedented, and we do need to track what has happened to the children who were born in this period, see what they need, and offer that support so that they can thrive as they grow and develop into adulthood.
For now, it's schools and their staff who are at the forefront of dealing with the long shadow of the pandemic.
Most teachers at the moment say they get inadequate training on that. We could really fix that very quickly if we wanted to. And similarly, the government funding so far for nursery workers training has only reached 3% of nursery workers in the last 2 years. We really need to get that up to close to 100%.
While this group are raring to go, attention will now turn to the children that have not attended preschool before.
For those children, the transition can be really difficult because we've got a really settled group here. We've put lots of our focus into making sure that first term those children are integrated into the group and are ready to start joining in with the learning activities too.
He's thriving. He's such a happy boy and he's doing so well now compared to where we began.
Oh, Mikhail, this is your bag.
Mikhail is able to talk to his mum for the first time because of the school's help, but there is still a long way to go.
I definitely think it's not just my son. I know as a year, as a group, there's a lot to catch up on and they definitely need the support.
For Mikhail and the reception class of 2024, a new adventure awaits. Vanessa Clark, BBC News, Bethnal Green in London.
Let's speak to Catherine Davis, who's a Professor of Language Development at Leeds University. Thank you for joining us, Catherine. You were involved in the initial research, weren't you? So just tell us about some of the biggest differences you observed among your cohort of families that you were following.
Sure, yeah. Well, this study is the most recent in a programme of research we've been working on. This particular study, the bicycle study that was in your package just then, looks at several hundred families into 3 groups. So a group of children who were born before the lockdown, a group of children who were born right into the lockdown, like early 2020, and a group of children who were born a year later. Now, we don't have data from the second 2 groups yet. Those children are just starting school. So from the early data, we're seeing that those children who were able to access outside play equipment, libraries, more toys, etc., were doing better on their communication and thinking skills. Now, we know that wasn't easy during the pandemic, right, to engage in these kind of really enriching activities, particularly when families were dealing with a lot of other demands there. And so what we're really interested in with this new research is actually how those extremely early days and actually pregnancy and the birth experiences might play out in children as they start school and move through the system.
In a way, some of the findings probably aren't that surprising, are they? It's sort of what we expect. But the biggest challenge now is how on earth do you rectify that?
Yeah, that's right. A lot of the research, all of our data kind of confirmed what everyone can see. But I think for those children who are starting school now, it's really important to meet them where they are, not to hold them to sort of pre-pandemic standards. Now, the schools are already experienced with this, of course. Those children who started reception last September would have been aged 1 or 2 in the first lockdown. So schools are really familiar with the kinds of needs that these children will bring. You know, they're helping to develop their language skills, their interactions, etc. They're doing a fantastic job. But there's a couple of additional things I think that would make a big difference to these pandemic babies as they start school. One is increased resource for speech and language therapy and these additional forms of support for children who might have missed those early assessments and interventions during those kind of much earlier days during their toddlerhood. And also for schools and families to work together. It's really important when we talk about school readiness for this really kind of integrated approach between the child, the school and the family. And together they can support children in the best way and allow them to thrive as they start their education journey.
Professor Catherine Davis from Leeds University, thank you so much for going through the outcome of the research and what might be done to try and deal with the impact. Thank you.
Thank you.